taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike LeNoir and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. Welcome to the Wellness Watch. I'm your moderator, George Strait. Okay, a quick question. What is the deadliest, most neglected, and most widespread pandemic of our time? COVID? No. HIV? No. But I'll give you a hint. It's called the silent killer. In fact, worldwide, it kills more than 10 million people every year. And a third of those deaths occur in adults under the age of 70. The answer is hypertension, high blood pressure. What is it? Why is it so deadly? How can we prevent it? And if we have it, what the heck can you do about it? Those are the questions that we will answer in this edition of the Wellness Watch. We have the absolute perfect people to help us work through this. The first is Carmen Ward-Sullivan. She's a nurse and program director of the nursing program at Samuel Merritt College and an expert on dealing with hypertension. And of course, we have our host, an expert on his own, Dr. Michael LeNoir. I guess the first question to both of you guys is, what is hypertension and why is it so bad?
Hypertension is, simply put, or high blood pressure, too much pressure or force within the vessels in our body, and the pressure of that pressing against the blood vessels in our body, what causes our blood pressure to rise.
So that's certainly a good definition, but most people define it, Dr. Ward-Sullivan, by the numbers. So how do you define hypertension by its numbers?
Well, currently the research suggests that any blood pressure 120/80 or lower is normal, and a blood pressure above 120/80 is considered high. Years ago, when I first entered nursing back in the mid-'80s, the blood pressure of 140/80 or 90 was acceptable. But now with the research, we know that chronic exposure to having your blood pressure above 120/80 and over time impacts our organs and can cause kidney failure.
And give us some more examples of why hypertension is so bad for human beings.
When we think about, for example, if I can give an example of being on Highway 80 in the East Bay, and in the morning, the traffic is not bad driving eastbound, right? It's just slow. You can drive as quickly as you want. As the afternoon progresses, we see the traffic beginning to slow. And then by early afternoon, eastbound on that Highway 80, then we see the highway come to a complete stop. So if we take that and think about the impact of high blood pressure on our vessels over time, it comes to a complete stop. It can stop us dead in our track. So one is at risk for having heart disease or stroke, and being placed on a kidney dialysis machine. And so it causes impact to our body, our health, our organs over time in a way that it can just cause us to have poor health.
So it increases the work that every organ system has to do when the blood pressure is high. It's particularly difficult when we talk about the kidneys, isn't it?
Yes, absolutely.
What happens when the kidneys fail?
Well, when we think about the amount of pressure or fluid or volume on our vessels that feed the kidney, for example, that over time causes the kidney damage. And so when kidney damage and the kidney fails, then it's not able to pull off that fluid in our body. And one may be subject to having to go on dialysis 3 times a week and sometimes 4 times a week. And that overall changes the lifestyle of that person.
And what about when hypertension over time has an impact on the brain?
If we think about the hypertension, and I mentioned earlier that we know that the inner lining of the blood vessels can become a little narrow, and there's inflammation that builds up, and some of the internal lining or particles in the vessels can become dislodged and enter the brain, in the vessels in the brain, and cause someone to have a stroke or a transient ischemic attack. And that affects their lifestyle as well, because if you have a stroke and it impacts a certain aspect of the brain, then you may have effects where you're not able to move your arm or your left side of your body or your leg, or your speech could be affected.
What I don't understand, doctor, is that, people know about hypertension. They know that hypertension leads to stroke and leads to cardiac disease and kidney disease. Why is it so difficult to get people to understand whether or not they have hypertension and to seek some kind of intervention? Where are we going wrong as primary care providers or providers of care for the general population, especially for the African American population? This is no secret.
It is hard. I agree, Dr. LeNoir. It is so challenging. Oftentimes we'll hear of hypertension or high blood pressure being the silent. And as we think of that, there are no symptoms or very few symptoms that one might notice and think, well, I should probably go see my provider because I'm experiencing a headache, or I'm having blurred vision, or I'm just exhausted. That may not be something that sends that patient to the hospital. So we just continue on living our life, going about our daily practices, and not think about stopping to do something as simple as checking the blood pressure. The machines are so inexpensive now that anyone can purchase a machine at various stores and check your blood pressure. That should become part of our routine of just checking at home. And if the numbers don't look right, then maybe that should be a cue to get someone in to see their healthcare provider. And oftentimes we're in denial. We just feel like, well, I don't need to go in and see my provider. I'm fine. I'm exercising every day. I'm eating right. I don't need to check my blood pressure.
Do you think that part of this is that there's not a good communication around hypertension between patients and their primary care physicians? In other words, if you go in for regular checkups once a year, especially after you get over 40 or 50 years old, or if you've got a history of hypertension in your family, or history of heart disease, this is not a discussion that's always had.
That's true. That's just, you're going in to see your provider perhaps for just one concern. I just need my physical and then I'm out of here, right? But stopping to have those really serious conversations about what can one do over time to protect their health, that's critical. And sometimes we get busy, the providers might get busy and forget to ask, but patients need to take it upon themselves as well and make sure this is part of their regular questioning when they go in, not just having the medical assistant checking your vital signs and then that's it. Have that heart-to-heart discussion and understand what your risk factors may be over time.
Let me push back a little on that, because obviously it's not popular to blame anybody.
Yes.
But most doctors, when they see hypertension, explain to the patient that this is hypertension, this is what you do, yet things continue to go on. I can't tell you how many times I have seen patients with strokes or with heart attacks or with kidney failure, and I say to myself, what a pity it is they didn't take better care of themselves. Because often the message is there and the messenger is there, but the message is not incorporated into the day-to-day lifestyle of so many people. And I think that's really, that transition is where we're failing. We don't have a system that checks on blood pressure like that. In certain Scandinavian countries, almost everybody, and I think it's either Sweden or Denmark, is hooked up to monitors. And so they can monitor on a regular basis when people's blood pressure goes up. We don't have that system in this country. And I think we need to do something in our messaging that creates a little bit more urgency in people with hypertension. Now, there are other diseases, though, that contribute to hypertension. What are some of those, doctor?
Well, if we think about, besides chronic kidney disease, we could think about diabetes and, of course, heart failure over time. Those are also partnered with, if you will, high blood pressure. And so just taking care of our blood pressure at such an early stage, I would even say, begin checking in your 30s, your mid to late 30s, check your blood pressure just so you have a baseline, so that you can prevent or delay the impact of some of these conditions and diseases that may visit you later in life, midlife and later.
It's almost like a mantra. But what can be done to prevent hypertension? What are the steps people can take?
Well, I like to think about exercise being one because that's so simple. The latest American Heart Association recommendations are if we exercise at least 150 minutes per week, that will help us. And so that equates to, if you think about 7 days a week, that's about 20 minutes a day, 10 minutes out for a walk, or 10 minutes out from your home and 10 minutes back, walking your dog or talking with your neighbors. If you look at exercising perhaps 5 days a week, that's 30 minutes, 15 minutes away from your home and 15 minutes back. That's all it takes every day to be as the first step. The second step I would recommend is eating a Mediterranean diet. Some people are moving towards plant-based, but a Mediterranean diet is just fine. And that's, of course, decreasing the sugar, decreasing your alcohol, decreasing the diet, and focusing more so on fruits and vegetables. That's the larger portion on your plate. And even just thinking about, fish and chicken, it doesn't have to be the largest portion on your plate, but that's in moderation. And so that's nuts, beans, legumes, lots of veggies that I can list, of course. It may not be a favorite, but once one begins to change their diet, your palate gets used to that and accustomed to the new way of eating. So it's exercise, maintain a healthy weight, maintaining a strong social connection. You don't want to be in a position where you're feeling lonely and you don't have the social contact. That's another way to help decrease stress in the body. There was something I did a couple of weeks ago, and it's more in the meditation aspect. And a friend of mine started a business, and it's called Sacred Naps. And I thought, I'm curious, what is Sacred Naps? What can I do for myself? We live such a busy, hectic lifestyle. I went to her studio, she and her husband's studio, and we had a meditative moment where we're listening to soft music and breathing, and all of a sudden we had a nap. We took a nap for about an hour. It was so relaxing and revitalizing to me. So that's one way that I can reduce my anxiety. And I think I may have covered most of them. If not, please.
Yeah, well, I think I could use that nap concept, and there are lots of cultures where the siesta is a integral part of every day, and I think I've visited these cultures, and I kind of got into that siesta pretty quickly. I think if I took a siesta here, there would be some problems, but I do think that and mindfulness, other techniques are really important. What about the importance of salt?
That salt can be definitely a deadly factor over time. When we think about salt, it helps to, increase salt intake, causes our body to hold on to the fluid, and therefore increases the fluid and volume in our body, which later subsequently increases the tension in our body and the pressure, and it impacts the kidneys.
There's one risk factor that I don't think that we've talked about, and that's smoking.
Don't do it. Simple as that. Don't do it. We think about the little spasming of the vessels in the heart with that smoking. That is just bad. So if you are smoking, stop. If you're having a hard time stopping, just decrease by 2 or 3 cigarettes a day, and then eventually cut back completely. Wean yourself off. It does damage to your blood vessels and your body over time.
Yeah, and we have some information on our site at the African American Wellness Project. We talk to you a little bit differently than the American Heart Association does, because we really understand that people have heard this before, and they don't seem to get the importance of taking care of your blood pressure and how many problems you can have when that's not done. And so if you need a different style of conversation, go to our website at aawellnessproject.org. Hypertension is one of our major disease focuses.
That's so important, because I think that if we can, like you said, we talk about hypertension, ways to avoid it, ways to decrease our weight. But if we're not hearing the message, even though it's been said, it's not resonating with us, especially as an African American community. So we really do need to go to your website and talk to people, professionals that look like us, and may be able to speak to us in a different way that we'll really hear it and listen, because it does impact our community more so than other racial and ethnic groups.
This has been really terrific. One of the best things I think about this discussion of hypertension is that it gets to some basic issues that both of you have raised. And one with Dr. LeNoir talking about the messaging that we all know that hypertension is bad. We sort of know what the numbers are. We sort of know what we should be doing and shouldn't be doing, but we aren't. But that communication somehow is broken down. The message isn't getting through. But I think this conversation will help spur the folks who watch it to better understand. But also, this information is made available to practitioners as well, so it can help them as they interact with their patients. But also the very clear and concise way that Dr. Sullivan has described just what hypertension is and how it affects the body, I think is crucial for people to understand how important it is to know those numbers and what those numbers really mean. People come from the doctor and they should know their cholesterol. Well, they should also know their high blood pressure numbers. And maybe when they go into the doctor's office, they've got a little piece of paper to sort of be able to write all those things down, so they can come home and tell their kids when the kids say, "Well, what did the doctor say?" That now they'll be able to have some good information. So I want to thank you both for this wonderful discussion. And Dr. LeNoir, if you'll take us off, that'll be great.
Yeah, before we do that, an anecdote. I once talked to a cardiac surgeon, and I asked him what he thought when he did these coronary artery operations, and cardiologists with stents. And he said to me, he said, "I always think what a pity it was that they didn't take better care of themselves." And I think that's true, certainly with hypertension, maybe as the number one focus for that issue. So I want to thank you, Doctor, for joining us. And I want to thank those of you who are watching us and who watch our programs, The Wellness Watch, on a regular basis. And always are, as we say, health is your biggest asset, so protect it.